Greetings everyone. I am Dr. Premkumar Balachandran, Senior Consultant and Clinical Lead of the Apollo Institutes of Hernia Surgery and Abdominal Wall Reconstruction here in Chennai. So I am going to be covering a very important aspect of hernias today, which is ailing most of the people. This is the post-pregnancy hernias and divarication of recti. A lot of my patients, when they come and see me, they ask me, "Doctor, you keep saying divarication. What is this divarication?" is what we want to know. See, basically what we all must realize is that the abdominal wall consists of various muscles, and these muscles are held together in the center by a strong tendon. The abdominal wall, contrary to popular belief, does not only protect the internal viscera, it is also a secondary muscle of breathing. That's why when you notice whenever you breathe, your abdominal wall also moves. And also it gives support to the back and spine. So with each breath and with each movement, your abdominal wall, the muscles keep separating little by little. So following pregnancy, what happens is, as we all know, the abdominal wall distends and the muscles start stretching. So in the early postnatal period, that is following the delivery, ideally we are supposed to do postnatal exercises to keep the abdominal muscles strong. But what happens if we do not exercise? The muscles keep stretching and the central strong tendon becomes weak and it starts splaying away. So this is what we call as divarication of recti, that is splitting and separation of the rectus abdominis muscle of the abdominal wall. Why is this condition worrisome? See, like I said, as we keep breathing, this divarication keeps increasing in size. So suppose someone were to develop a hernia, and this hernia occurs within the divarication. Previously, only the hernia used to be corrected, and because the divarication is not being addressed, the hernia starts recurring. So that's why a lot of post-pregnancy women who got hernias, they keep complaining that my hernia keeps coming again and again in spite of many surgeries in the past. Secondly, people who have undergone cesarean section following for the delivery, what happens is, if they do not exercise and if they start working too early following the surgery, what happens is the stitches on the cesarean scar give way, causing a incisional hernia, and because the muscles are weak and they have divarication, these hernias start increasing in size. Now a lot of people ask me, "Doctor, why don't we just take rest and not do strenuous activities? Will these hernias spontaneously recover on their own?" The answer is a definite no. Hernias do not get all right on their own. It is an anatomical defect, and any anatomical defect needs to be surgically corrected. So how do we go about doing these surgeries? First of all, we have to assess the patient and see how symptomatic they are and how much it is affecting their day-to-day life. It is better that the patient seeks surgical care or a consultation with the doctor even at the early stage, and do not wait till later stages and till they become very symptomatic. When you meet your surgeon, they will clinically examine you and find out how big your hernia is and how significant is your divarication. Following this, we will do a couple of tests, including a CT scan of the abdomen, ultrasound, etc., to find out the size of the defect, the size of the divarication, to ensure whether there is any adhesions of the internal viscera to the hernial wall, etc. Following this, you will be advised surgery. Most probably, in many cases, these can be corrected by laparoscopy itself. Unless and otherwise it is very large, then you may need to have an open surgical procedure. By laparoscopy, what we do, we go in, we close the hernial orifice, the hernial weakness is closed, the divarication is brought back together and repaired, and we place a mesh. Now, there is a lot of controversy about whether to put a mesh or not. See, one has to realize that the muscles do not gain their normal strength. Once a surgery has been done, that part of the body never regains 100% strength at all. Even after a year, it will only recover about 90 to 93% of its original strength. And in the early phases of post-operative phases, we need some other supportive mechanism to prevent recurrence. So a mesh reinforcement is always required, unless and otherwise there is an infection, and in an infective process, we cannot put a mesh. So these are the common queries that one raises about divarication and post-pregnancy hernias. I hope I have been clear. Thank you very much.